Good afternoon, everyone. Magandang tanghali po sa lahat. Welcome to the 297th episode of our webinar series. Thank you so much for being a part of our credible online community. And to all those who have just discovered us today, welcome po. And today we will answer the question, GLP-1 siguro po alam nyo or hindi kayo masyado aware sa GLP-1 pero pag narinig nyo na yung mga pangalan ng gamot katulad ng Ozempic or Mounjaro, mas familiar po iyon. No? So just a backgrounder for our topic, the country is grappling with a dual health crisis, with the International Diabetes Federation estimating that over 4 million Filipino adults are living with diabetes, while obesity rates continue to climb steadily across the country. So yung diabetes po at saka obesity are chronic conditions that place a massive burden on the national public health system, underscoring the urgent need for a shift toward proactive lifestyle management and innovative clinical interventions to secure better long-term health outcomes. All over the world po, ang GLP-1 receptor agonists, commonly known with the brands including Ozempic, Mounjaro, or Wegovy, have emerged as a transformation or a transformative tool for metabolic health, with clinical studies consistently demonstrating significant reductions in both HbA1c levels and body weight for patients. As these medications become increasingly accessible in our country, they are poised to reshape the local approach to chronic disease, offering healthcare providers and patients a powerful new strategy for effective long-term management for these conditions. This is the Health Updates Program. Ako po ang inyong host ngayon, Dr. Dayon Sakdalan. It's always a pleasure to be with all of you, our regular Friday lunch dates. It's also our pleasure and honor to co-host this program together with our mentor, Dr. Stella Jose, and later on with Dr. Raymond Sarmiento. Good afternoon po, Ma'am Stella.
Good afternoon, Dion.
Ma'am Stella, can you speak again?
Good afternoon.
So ito pong episode natin na ito ay very special. Kasi po ito ay co-presented by the UPMASA or the University of the Philippines Medical Alumni Society in America. This organization is founded in 1980 and it's volunteer-led organization of over 2,500 medical practitioners who are alumni of the UP College of Medicine. Either they train there or they are practicing in America, but they are united to promote the science of medicine, guide new graduates, mentor them, and support educational and healthcare needs of the UP College of Medicine, the Philippine General Health Hospital, and the Filipino people in general. So, Ma'am Stella, okay na po ba yung audio?
Yes, I'm on the air already.
Yes.
For our participants here in the live broadcast of the Zoom webinar and to all those watching via sorry, to all those watching via live streaming on the TVUP YouTube channel, as well as the UP System Facebook page, the TVUP Facebook page, and of course, all those watching from TVUP. Today on Health Updates, we are joined by Dr. Kenneth Ligaray, who will answer the questions GLP-1 meds for diabetes and weight management, Epektibo ba? To provide context to our webinar, we have interviewed medical students who understand the common understanding about their understanding of GLP-1s with the questions, ano ang mga pamamaraan na pagkontrol ng timbang at diabetes na alam nyo? Ano ang alam nyo tungkol sa mga GLP-1, Ozempic, Wegovy, Saxenda? Para saan kaya ito sa tingin nyo? Sa tingin nyo ba ang gamot na ito ay madaling bilhin o mura? So let's watch this. We have our person on the street.
Well, one is diet, so eating the right things, and exercise.
to my knowledge, it's more on calorie deficit and more of exercising. You know, the more traditional ways of losing weight. Other than that, I know people like to take like supplements and yeah, different kinds of stuff that they ingest in order to lose weight as well.
Dating sinabi pa rin ng mga ibang doktor na kadalasan maririnig mo kagaya ng kumain ng masustansyang gulay, mga masustansyang pagkain, mga fast food, tumayo ka, lumabas ka ng bahay, lumakad ka, mag-exercise ka.
Yeah, I've heard about it. I know it's to control your insulin. So, for people who suffer with insulin resistance, like makes you lose weight also. So, people use it both for aesthetic purposes and also for endocrine purposes.
Also on, because I'm also on Monjaro, so I'm pretty avid in the ways of like the idea of GLP.
Like restarting a person's gear. So there are disorders or conditions where the body is unable to function properly because of endocrine problems, right? So in a way, that's a way to restart and make your body function properly.
Like, given the condition that I have right now, parang it's more for stability and more of like losing the things that are high in my blood. Yeah. So basically, what I was oriented about it was that like if I take this, it's going to drastically reduce my weight as well as start regulating the other stuff in my blood that need to be regulated.
Narinig ko na yung mga yan, pero nung nakita ko na yung presyo, wala na akong pakialam.
I think it's easy to purchase, but it's not cheap. So it would also depend on someone's socioeconomic background, if they could afford it, or if it's even.
I think it's very expensive, and I think like I wouldn't say rightably so, because I think that like if everyone would have access to it would be a lot better for people to like regulate their the things in their blood that they need to regulate as well.
Kung mahal at hindi mo kayang bilhin, huwag mo nang patulan. Nung nalaman ko yung presyo, hindi na ako pumansin palalo ng mga detalye. Basta kung pinapakita nila, pumapayat ka, okay, sige. Pero hindi na ako interesado.
Right now, it's pretty high and pretty more upscale because it's not seen as like the standard for how we should be going about. But I think everyone kind of thinks it's kind of like a cheat code.
Hindi para sa lahat. So parang hindi na rin ako interesado.
Or if it's sustainable for them, because most of it you have to do it for 6 months. It's more of you can't just stop in between. So it's kind of a full commitment thing. That's why I think it's not as accessible to everyone.
Okay, so mukhang maraming alam po ang ating mga persons on this about the updates on this very magic drug, if I can say that, and we will try to discuss that later on. So thank you very much, TVUP, for putting together those insights from our from the people in the community. So salamat po. And for all those asking, certificates of attendance will be given to those who have watched at least 50% of the webinar's duration. So for today's webinar, we have one speaker. We will open the floor for questions and a quick discussion after the presentation. Okay, so let's proceed now with the topic at hand, and Dr. Stella Jose will introduce our speaker. Ma'am Stella?
Let's get our webinar underway. Our main discussant is Dr. Kenneth Ligaray, an alumnus of the UP College of Medicine year 2001. He is an active collaborator of UPMASA and a clinical associate professor at the University of Wisconsin School of Medicine and Public Health in Madison, Wisconsin, USA. So let's welcome our host, our discussant, Dr. Kenneth Ligaray.
Hello, everyone.
Afternoon,
Thank you, Doc.
Ken.
Hi, Doc Dion. How are you?
Afternoon, Kenneth.
Hi, good
We're good.
afternoon. Thank you, Dr. Jose, for that very nice introduction. Hi, Dion. Uh, Hello to everyone. Magandang araw po sa lahat ng nanonood. I am honored to be here as the first presenter of this series of collaboration between TVUP and UPMASA. So thank you, TVUP, and thank you, UPMASA, for the invitation. I will now pull up my slides and we're gonna go. Are you able to see my slides right now?
Yes, we can
Thank
see
you.
it now, Ken. Maybe you can speak a little louder.
Sounds good. So,
Yeah, thank
is that
you.
better? Okay.
Yes, that's better.
So,
Thank you.
we are going to talk about what do you know as GLP-1 medications that we use for diabetes and weight management. And these are some of the questions that during the presentation I would like to cover. So, number one, how are newer medications developed? And more specifically, what is new in the endocrine world? I wanted to present a little of this because I wanted to show you that the development of new medications in endocrine also parallel, at least in style, the development of GLP-1 medications that we know. There's a lot of science to it, biotechnology, innovation, and even creativity. So I'd really like to show you that part. Second question we'd like to cover is what are incretins? So we know the term GLP-1. Are we also familiar with the term incretins? And what is the role of these in the treatment of diabetes and the management of weight? Number three, ano ba talaga tong GLP-1 na to that we keep on hearing about? And how are incretin-based medications developed? Epektibo nga ba, as what's written on the title? So we'll go ahead and start with what's new in the endocrine world. So this is a picture of the human insulin that we know. So to those who are treating diabetes and are familiar with this is what we know as the short-acting insulin. Onset of action is 30 minutes. It peaks in about 3 hours, and the duration of action is about 8 hours. So there are very smart people out there who made just little switches of amino acids that you can see on the screen. And suddenly, that short acting insulin that we know is now a rapid acting insulin. So onset of action is now shorter at 15 minutes. Peak is from 3 hours nung regular insulin. Ngayon, it's just 1 hour. And the duration of action is shorter. So one advantage of that is that you can give it right before the meal and you don't have to wait 30 minutes before you can start eating. Same with another common insulin that you know of, insulin aspart. There's another amino acid switch somewhere in the chain of the human insulin, and that also became a rapid acting insulin. Even faster than a rapid insulin is an ultra rapid insulin. So, what they did here is insulin aspart, they just added vitamin B3. And with that, onset of action is now just 2 minutes, even so much faster than your rapid acting insulin. Duration of action is still 4 hours, but it peaks even quicker, 30 to 60 minutes. So there are patients who are very sensitive to how fast the insulin works. So to those who want insulin that's acting even faster than one they usually use, they can go on this kind of insulin. The next insulin that we're going to talk about is insulin glargine. You're probably familiar with this insulin as a long-acting, 24-hour acting insulin. And how did we come up with this 24-hour acting insulin? So some changes in the insulin chain, just like the other insulins, but different amino acids were affected. Now, this insulin became soluble in acidic pH of 4, with the addition of zinc in the solution. When you inject this insulin into the skin and it's exposed to natural pH, they form microprecipitates. So, mas mabagal ngayon ang release of insulin to the bloodstream from the skin. And now you have a 24-hour insulin that you can inject once a day. This is the newest one, and this was just approved last March by the FDA here in the US. This is called Isolin Icodec, or brand name a weekly. What they did here is they linked a fatty acid into the molecule of the insulin, making it more covalently bound to albumin. And that binding with albumin made it even more long-acting. So yung half-life ngayon ng insulin naging 8.2 days that it allows for once weekly dosing. So nakita nyo just some changes in the peptide chain, some addition of other things around the peptide chain, and it becomes a new medication with a new purpose. Other than insulin is replacement hormone for hypoparathyroidism. So for the longest time, we have replacement for deficiency in many glands like thyroid and pituitary functions, but we did not have a very effective replacement for hypoparathyroidism. So this is the parathyroid hormone. We use this segment in the treatment of osteoporosis, but it was not very effective in the use for replacement for hypoparathyroidism. But with this new technology called transient conjugation technology, it became a much longer acting molecule, 30 to 60 hours. So now, finally, we have replacement hormone for hypoparathyroidism. So ganun yung style ng pag-develop nila ng newer medications. So let's see what's going on with GLPs. But before that, just a little background about diabetes. Dr. Dion talked about it earlier, sa data from IDF. At least 40 million people affected with diabetes in the US, almost 5 million affected in the Philippines. At marami pa niyan ang hindi diagnosed, so it will be much higher than that if we are able to diagnose everybody. So I remember when I was in med school, it was easier to understand the reasons behind elevated blood sugar in diabetes. Tatlong reasons lang yung alam natin then eh. Impaired insulin secretion, increased glucose production from the liver, and decreased glucose uptake in the periphery, for example, the muscle. So yung mga disorders na yon, they all lead to elevated blood sugar or hyperglycemia. More recently, hindi na 3 reasons, we have 8. So we call that the ominous octet as labeled by this thinker in endocrinology, si Dr. DeFronzo. And these 8 reasons include impaired insulin secretion, increased glucagon secretion, increased production of glucose from the liver, some neurotransmitter dysfunction, kasama dyan ng dopamine, decreased glucose uptake in the muscle and other peripheral tissues, increased glucose reabsorption in the kidney, increased lipolysis, and one of the 8 is decreased incretin effect. So, most recently, baka maging 9 na. So, noxious 9 na yung tawag ni Dr. DeFronzo to include problem with increased activity of cortisol. What we are going to focus on today is this part, decreased incretin effect. So, what are incretins? So, let's go back to data from the 80s. There was a study where they gave glucose to patients, but they gave some patients glucose by mouth, orally, and some of the patients were given glucose intravenously. So the effect on the increase in glucose is pretty much the same. No? Tumaas naman yung glucose, but the insulin production is different. Those who receive glucose by mouth increase insulin production so much more than those who receive glucose intravenously. So that difference right there is what we call incretin effect. And now we know that incretins are produced in response to food by some cells in your intestine. And the most commonly studied incretins are your GLP-1 or glucagon-like peptide 1 and GIP or gastric inhibitory polypeptide. So yun pala yung GLP-1. It's one of the incretins that in response to food is produced by your intestinal cells. And the major functions of GLP-1 and other incretins would be to increase insulin production, decrease glucagon secretion, delay gastric emptying, and decrease appetite. So yun yung 4 major effects than incretin. So I make my students memorize those: increase insulin, decrease glucagon, delay gastric emptying, and decrease appetite. So as you can see, it's good for people who have diabetes, right? Because these are all good things to happen if you have high blood sugar. Additional information that we know is if you have diabetes, meron ka rin palang deficiency sa GLP-1 and other incretins. So ito ngayon yung role ng GLP-1 based medications to improve those four effects and other positive effects kasi may deficiency sila sa GLP-1. So what can we do? Maybe we can give our diabetes patients GLP-1. Yeah, we can. The problem is GLP-1 only lasts about 2 minutes if I give it to a patient with diabetes. It goes out of the system right away because there is an enzyme right here called DPP4 or dipeptidyl peptidase 4 that degrades the GLP-1 super fast. So I'll give it to you, it goes away. Wala nang effect. So maybe I have to give it as an infusion to be effective. But sobrang hassle naman yun to carry around an infusion of GLP-1. So before the GLP-1 medications were developed, there was a class of medication that would inhibit the DPP4 enzyme. And those are your DPP4 inhibitors. Familiar sila as the gliptins, like your linagliptin or your sitagliptin. So what can we do now? Kasi limited na yung medications natin. Well, there's another smart person, Dr. Ang from New York, who discovered that saliva secretions of this reptile called the Gila monster actually contains a peptide called exendin 4 that is 53% homologous to the human GLP-1. So that exendin 4, developed in the lab now, became our very first GLP-1. The brand name then was Byetta. So it was approved in the US in April 2005. It was eventually produced by AstraZeneca. The half-life of this medication is 2.4 hours. So when you prescribe this medication, it was a twice daily injection. It can reduce your A1C to up to 1%, and it did show some weight loss. Konti lang noon, it was 4 to 5 pounds, around 2 to 3 kilograms. But the patients got very excited. They would come to my clinic and ask for them to receive prescription for what they called lizard spit, because it did come from that reptile that I showed you earlier. But can you just imagine to inject this medication twice a day when you're already injecting insulin? Let's say you're already injecting insulin 4 times a day plus 2 times a day of Byetta, so that's 6 times a day of injection, right? So another company, this time it's Novo Nordisk, developed our second GLP-1 medication in the market. It's called liraglutide. So liraglutide is based on the GLP-1 molecule with some changes in the amino acid, and then they connected a fatty acid to it to make it a longer-acting medication. Now the half-life is 11 to 15 hours. It allows for once daily dosing, and A1C reduction can be up to 1.8%. Weight loss with the higher doses could be up to 8% of the body weight. So interesting, sa GLP-1 medications, you have one generic name and they sell it and market it with 2 brand names. One of them is for diabetes and the second one is for weight loss. So in this case, the weight loss medications have higher dosing. So what's good about liraglutide is that it was the very first GLP-1 medication that was able to present and prove positive cardiovascular outcomes in a big study. So primary outcome, better. Even death from cardiovascular causes, it was better to be on a GLP-1 medication. So that's once a day, right? So sabi nga ni AstraZeneca, I can do better than that kasi sila yung nag-produce ng twice a day Byetta. So they were able to come up with a once a week medication. This time they branded it as Bidurian using what they called microsphere delivery system. Not exactly the same, but analogy is if you can imagine absorbable sutures that we use for surgery. Imagine microfibers of that suture infiltrated with this medication. So you inject it, as the body slowly dissolves the suture, the medication is slowly released into the bloodstream. So slower and longer acting na yung medication mo. A1C reduction is up to 2% on this one. Average weight loss about 3 to 6 pounds. But then it's a once a week injection. Kaso lang, this solution was kind of heterogeneous. You have to tap that pen on your palm 70 times para maging homogeneous in solution. And if you see that needle that's attached to it that came with the medication, that's a gauge 25 needle. Medyo makapal pa, diba? Kasi the needles that we use now to inject insulin, they're either gauge 30 or 31. So medyo hassle din kahit once a week. So another company came up with a newer medication called albiglutide. So it's interesting how they did this medication. They used two modified GLP-1 peptides and they genetically fused them to recombinant albumin. So that albumin tail dramatically extended the drug's life and it allowed it for a once weekly dosing. Unfortunately, this product by GSK is not in the market anymore because it did not do very well in the market. It was kind of effective, but it did not sell so much. So voluntarily, they stopped producing this medication. So what's next after this? So Lilly came up with a once weekly medication na rin, and this is your dulaglutide or brand name Trulicity. So once a week medication. How did they make it a longer acting medication? So there's a synthetic 16 amino acid peptide connected to the GLP-1 fragment to the FC fragment of the IgG4, and that made it a longer acting medication. So with dulaglutide, A1C reduction is up to 1.9%, and weight loss is also not so much, 2 to 7 pounds. But the next one, dito na nagkagulo kasi everyone wanted to be on semaglutide, brand name Ozempic or Wegovy, because this gives you weight loss average of 14%. And in one study, up to 28% lost 20% or more of their baseline weight. I just want to remind you that when studies present data like this is average weight loss. That means some people lost about this much weight, some people lost so much more, some people lost less than this, some people probably did not lose weight at all, and some people probably gained weight in the study, but on average, they lost about 14%. So semaglutide was approved in the US in 2017. This is a modified analog of GLP-1, and then they connected another fatty acid right here to make it a longer acting medication. So ngayon, si Lilly medyo mahina yung GLP-1 product niya. Si Novo Nordisk medyo malakas si semaglutide. So sabi ni Lilly, wait, I have another product for you. And this is your tirzepatide. This was approved in May of 2022. What they did is they combined a modified segment of GLP-1 along with a modified segment of GIP attached to a fatty acid to make it longer acting medication. So because of what they did, now this one molecule activates two receptors. So it's an agonist for both your GLP-1 and also your GIP. So weight reduction up to 20 to 23% for those who are taking either Mounjaro or Zepbound. And then A1C reduction can be as much as 2.4%. So these are all the injectables that we have right now. Puro naman injection. What about those people who don't like to inject themselves, right? So yung semaglutide, they came up with pills. So approved in 2019, the brand name then was Rybelsus, and then more recently was reformulated and updated. So we have Ozempic pills and Wegovy pills. they still offer good weight loss, mga 14 to 17%. So ayan na. So si Novo Nordisk may magandang product, injectable. Si this is Lilly, may malakas din na product, injectable. Ngayon, may pills si Novo Nordisk. Sabi ni Lilly, kung may pill ka, ako din may pill. So, April 2026, just a few months ago, this Foundeo, yung brand, was approved here in the US. What's different about this? It's not even GLP-1 peptide. It's a totally different molecule, but it still stimulates your GLP-1 receptors. So average weight loss nito can be from 13 to 17%. So that's the newest one that we have in the market. So as you can see, it works, right? It works to decrease your A1C, yung mga GLP-1/GIP receptor agonists, and they also work to decrease your weight. But then again, remember, average yung pinag-uusapan. Some people might not lose weight, some people might gain weight while on the product, but most of the people do lose weight. So hindi lang weight loss and diabetes yung indications of our GLP-1 or GLP-1/GIP receptor agonists. Yung brand Wegovy is also approved for non-cirrhotic metabolic dysfunction associated steatohepatitis, so yung fatty liver. And if you're familiar with it, they stage the liver, so it's indicated for stages F2 to F3. Yung brand Zepbound naman, generic tirzepatide, is approved for moderate to severe obstructive sleep apnea in adults with obesity. So what are the common side effects? So every time we talk about medications, we talk about the good things, and we also talk about the possible side effects. So most commonly, if patients do complain of side effects, it's GI. So feeling nauseated, vomiting, diarrhea, constipation. So if mild lang naman yung nausea, we keep going with the medications. But if they keep vomiting, like vomiting every day, maybe it's not the best medication for them. Very rare side effect, but it's good to know, is loss of vision. And the description that they give here is non-arteritic anterior ischemic optic neuropathy. So it's not the diabetic retinopathy typical pattern. It's non-arteritic ischemic issue. So if those are the ones that are listed in the PI, some patients come and report about some side effects that they experience. For example, hair loss. Patients are coming saying, Doctor, I'm losing my hair with this medication. I'm not so sure if it's from the medication, but if you follow the sequence of events, mukhangang it's from the medication. So something to watch. Some people complain of back pain. Some people complain of muscle and joint pains. There's a patient who's complaining of allodynia in the lower extremities since the patient started on a medication. And there's another patient who complains of palpitations and thinking it might be from the medication. So I have no proof that these are really from the medications, but patients are complaining about these. So which one is best for weight loss? Kasi marami tayong na-mention, diba? I would think the newer ones are, but I think the best one would be the one that you have access to, the one that you can afford. Because if you're not able to, then you're not going to be able to use it and sustain it, then it will not be very effective. Here in the US, it also depends on what your insurance covers. So certain insurance would cover a certain brand. So, but I think the newer ones are very effective in terms of the purpose of decreasing A1C or losing weight. So you may ask, which ones can be used in kids? So the Monjaro brand can be used in children 10 years and older and adolescents. Trulicity, also 10 years and older and adolescents. Yung Wegovy naman is approved for children 12 years and older and adolescents. So what is in the pipeline? So this is, I think, my almost last slide, is what we call GLP-3. So GLP-3 is not a peptide itself, but they're using that term to talk about retatrutide, which can stimulate three receptors. yung receptor ng GLP-1, receptor ng GIP, and the glucagon receptors as well. So it's still under study right now. It's a once a week injection, but data is very promising. A1C reduction can be up to 2%, weight loss of roughly 24%. That's pretty good. And in their study, 1 in 4 patients lose 30% or more of their weight. So when are we expecting this medication to come out? Maybe possibly later this year or up to mid of next year. So I think that's all I have for you. Yun ang kwento ko for today. And I think we can start answering some of your questions if you have them.
Thank you very
Thank
much,
you very
Kenneth.
much, Dr. Ken.
Yes.
Very interesting story of the evolution of this very wonder drug. Ma'am Stella, what can you say po of Dr.
Yes,
Ken's
yes,
presentation?
very interesting, and I hope our audience appreciate the talk of Dr. Kenneth. That even here in the Philippines, we have very obese patients, no? So I'm not surprised na, especially in the US, I'm sure because of the food that people eat. So let's hear from our audience. Baka they have questions.
Yes, Ma'am Stella, I think I can see some questions in the Q&A, but just to remind everyone for today's Q&A session, we will choose from the upvoted questions, and we encourage you to type down or type up your questions in the Zoom Q&A, or if you're in the FB page, please feel free to write on the comment section. And Doc Stella will probably pose the first question to Dr. Ken.
Kenneth, my question actually is, so even in children, it is common to have obese children in the US, and they are given medicines already. So what is the downside of that? Because for children, of course, it can damage their immune system and all that. So what is your comment?
So I think treating obesity, especially in children, should be a multi-specialty thing. It should be a team effort because iba-iba din yung dating sa bata emotionally kung if you worry too much about their weight. There are kids who are genetically on the heavier side, but they are very active physically. So I think that's okay. So we don't rush into giving medications. We encourage them to eat healthier, better choices in their diet, and not resort to medication right away. I think would be my way if I'm treating these kids with obesity.
Also, I think no children should exercise more and wag masyado mag-TV kasi
Right.
palaging ganon.
So
So,
encourage them to go outside, play,
yes,
exercise. I mean, even something fun.
yes,
Um,
I agree. It's really
And
for
maganda yung sinabi ni Ken, Doc Stella, na it has to be a multidisciplinary approach, not just give the meds, but maybe provide support also in terms of wellness, healthy lifestyle. And sometimes baka meron din silang mga uh, concerns na hindi masyado nila na-express. So maybe, of course, the parent should always be there, but if there is a need for psychological support, baka kailangan din open tayo with that, no? Ma'am Stella, meron pa kayong question dyan? I think there are several in the Q&A.
dun sa Q&A so far, puro mga ano pa lang, mga rainy blessed day everyone, yung mga ganon. Wait,
Yeah. I'm seeing
beyond,
one here, Doc Stella.
uh,
Meron po ako dito. Ako po muna
sige,
mag-post.
ikaw muna.
Yes. So there's one question. Tirzepatide is said to be given for long term, and there's still a slight rebound, although weight gain is said to not go back to the baseline weight. Can you comment on that, Doc Ken?
so this is the story of obesity now and weight loss. You lose some weight and then you're bound to gain some in the future. The use of tirzepatide, we actually don't have actual guidelines as to how long we're going to use the medication. The hope is that while you're on the medication, you learn how to adjust lifestyle so that by the time that you feel like you don't need it anymore, you're not going to get a lot of rebound. Another suggestion at this time is to start cutting back on the dose, to go down to what we call a maintenance dose, so it's not too high of a dose anymore, just to keep your appetite lower and maybe preserve some of the weight that you lost. So those are different ways of dealing with thirst appetite. But how long can you be on it? We don't really know because it's kind of a newer medication.
Mhm.
Okay. Thank you, Doc Ken. Doc Sarah, do you have a question on your end?
None at the moment.
Okay, so meron pa ho dito, there's a question on Ozempic phase. Is there such a thing? And maybe you can tell us a bit more about it.
Yeah, so everything that changes, they call it Ozempic something, right? Kasi nawawala yung fat content ng tissues mo, you probably are gonna lose some muscle as well. And because you lose some protein, you might lose some bone as well, because bone is part of the matrix. I mean, protein is part of the matrix of the bone. So kung sobrang pumayat yung face, kasi iba-iba yung effect sa iba't ibang tao, then they will call that Ozempic face. Sobrang pumayat yung mga daliri, they call that Ozempic fingers. Sobrang pumayat yung puwet, they call that Ozempic butt. But it's possible that you might lose a lot. Some of the patients actually worry that they are losing too fast and they would like to cut back on their dose. Kasi ano bang nangyayari sa akin, but ako sobrang namamayat, which other people are happy with. Uh, but it's just a label. So
Yeah.
to see those changes, they're calling it Ozempic something.
Okay, thank you.
Okay.
In relation to Doc
Yeah.
Sela, yes.
Can I ask, so these meds is it very expensive? I mean, for the regular folks, is it not too expensive?
So here in the US, it actually is expensive, especially if you don't have insurance, because the ones that are pharmacy grade, 1 month supply, that's 4 doses, because usually it's a once a week dose, can range from $1,000 to $1,200.
Oh, wow.
So that's like 50,000 and up
Okay.
pesos, right? If we convert, that's how expensive it is.
Mhm.
So if the insurance covers, especially if you have diabetes, dito, it might drop the cost to maybe 25 to $50 na lang, and insurance picks up the rest. But it
It's
could
really
really be
expensive.
expensive.
Yes.
It's very expensive. Relation to Ozempic, no, Doc Ken, there's question on whether there's data on the occurrence of thyroid problems and ophthalmologic side effects of Ozempic.
So in the side effects slide, we mentioned earlier that there are people, it's very rare, who complained of loss of vision, and it's not the same as diabetic retinopathy. It's an ischemic event that happens when they're on it. So just be aware, because it doesn't happen to a lot of people. Just be aware if the patient complains of loss of vision, go to ophthalmology, have them check and see what's going on. Maybe the medication has to be stopped. And then the other question was, sorry, Doc Dion, I forgot. What was the first
Yeah.
part of it?
So rebound ophthalmic thyroid
Oh,
problems.
thyroid. Okay. So I did not get to mention in my talk, but the only absolute contraindication in using this medication is history of medullary thyroid cancer, or a syndrome that we call MEN number 2. So
And to
multiple endocrine neoplasia 2, because that involves medullary thyroid cancer. So maraming tatanong, oh, I have history of papillary or follicular thyroid cancer. Bawal ba sa akin ang GLP-1? No, it's only if you have medullary thyroid cancer.
okay.
Thank you for your
Thank you.
answer. There's a question here. Is it true that if you are a diabetic person or high in sugar, you are suffering from frequent urination and sleeping time? So that's the
So,
question.
yeah, kasama din sa mga typical symptoms of having high sugars, yung 3 Ps na we learn in med school, di ba? Polyuria, palaging umiihi, polyphagia, palaging gutom, and one more that I am blanking out. Yes, if your sugar is high, ilalabas ng kidney mo yung sugar. Wherever sugar goes, dadalhin niyo yung fluid. So marami kang ihi. So you will ihi many times a day and you'll wake up at night multiple times to go to the bathroom.
Polyphagia, polydipsia.
Uh-huh.
Kenneth, I think no, we should emphasize more yung physical activity para ma-lessen natin yung mga children who have ganito, nagkaka-early onset
That's
of
very
diabetes.
true. So obesity, prediabetes, diabetes, the mainstays of treatment is lifestyle change. So better diet and exercise, with the intention of losing some weight. Sa mga trials kasi ng diabetes prevention, if you lose weight mga 7%, that's a really good thing your body will remember, and it's very less likely for you to have overt diabetes in the future. So yun. So medications are secondary. To a lot of people, it's needed, but the mainstays are better diet and more physical activity.
Yeah, thank you for your answer.
Thank you, Ken. I think it's also important to emphasize that we have to consult our doctors, not because these drugs are available, your friends are. So very important that we consult our doctor so that we can get the right kind or the right one with the right dose. Doc Ken, my question po dito, is it safe to take this drug if one has not been diagnosed with diabetes?
Okay, well, if you haven't been diagnosed with diabetes, but you have obesity, it is indicated for it. So, yes. Pero kung maganda naman yung weight mo, pero the BMI is not high, but you really want to lose some more weight, baka naman you'll see more side effects than effect kasi you're already where you're supposed to be.
Okay. How about if pre-diabetic? Sometimes you take your blood tests and then for the first time you get like a slightly high fasting blood or sometimes slightly high HbA1c. And then of course, di ba sa mga test results ngayon nakalagay na doon pre-diabetes. So is it also safe to take that if you're
So I'll tell
pre-diabetic?
you, it's not an indication for the medication right now for prevention of diabetes and using it in pre-diabetes. But my personal opinion, I think it's going to help prevent diabetes. We don't have the study for it.
Oh, not yet, not yet.
Not yet.
So
It's not part of the
still,
indication.
okay. So
But if you have
still,
pre-diabetes and you have obesity, then take it for that indication.
yeah. And
There's
of
a
course,
question. Oh, yeah,
yes,
there's a
doc, and of
question
course,
here. Can Monjaro be taken with patients with hyperthyroidism and is pre-diabetic?
Oh, okay. So two things going on there. What I'm gonna do with that is I will control the thyroid first. Kasi pag nag-experience siya ng side effect from tirzepatide or Mounjaro, it's hard to know, is this still the thyroid symptom or is this a new side effect from the medication? So I will stabilize the thyroid first and then think about starting tirzepatide.
Yeah, I think that's a
Personal
good answer.
personal style.
okay. Pero
And
again, we want to emphasize to our audience, very important po that we consult our doctors, that all these medications may be very effective, but of course we need to also know that they may have side effects, and it's good to consult your doctor before you start any of these medications.
also, nga pala Kenneth, here in the Philippines, you will see some obese children, ano, and sometimes yan ang nagiging issue why they fight in school or they get poor grades because of obesity. So it's really, this webinar is really for parents who are out there, no. So let's not make kasi maraming parents ganun eh. Gusto nila mataba yung anak nila, and which is not correct, no. What do you think,
So
Kenneth?
yeah, while you were talking about that, it comes also to mind that um, maybe people or kids coming from lower social economic status might have more problems with that as well, because the cheaper foods are high calorie foods or high carbohydrate foods. So it's unfair to judge people because of their body weight, because there are so many things behind it that's going on. Well, there's that. There's genetics, and there might be other like metabolic conditions that is not the choice of the patient. So, yeah.
Thank you for your answer.
Okay, maybe we can move to our last question as we are running out of time. There's a question on how do you taper tirzepatide after you've reached your target weight? I think this is for people who's taking it for weight loss.
Mhm. So again, there's no advice on how to taper. So I might jump bigger doses, like 15 milligrams is the highest dose. The dosing for tirzepatide is 2.5 increments from 2.5 to 15. So there's a lot of doses in between. So I might jump down from a 15 to a 10 and see how the patient is doing. And if I can still cut it back, I'll cut it back from a 10 to a 5 and maybe try to maintain on a 5. I was told earlier that the price of Philippines depends on the dose. So
Yeah.
if you stay longer with the higher dose, then that's more expensive medication, if that's correct.
And one more question also. I gave my sister Ozempic because I have a sister who's obese, no? And then she took it so consistently. Natapos niya yung one whole pack, 35 syringes. And then she lost weight na 6 pounds. And sabi niya, ate, gusto ko pang mag-lose more weight. So I gave her another dose of Ozempic. Is that wrong?
No, you
No,
can
it's
keep
all
going
right.
for years.
Anyway, so she did it the second time. She lost weight, 6 pounds lang din. Sabi ko, I think you have to exercise kasi it's not really the medicine. What do you
Yeah,
think?
that's true. And there are people who really do not respond well. There are people who do not lose weight at all. There were information na lumabas na maybe 1 in every 10 people that you treat will not respond to this medication. Probably there's genetic basis for it, but we don't have that information right now.
Thank you for your answer.
Mhm.
That's all in questions ko. Dion.
Thank you,
Thank you
Doc
for your
Ken.
questions.
Very lively discussion. Someone's commenting here in the chat box.
Oh, thank you.
Yes, they appreciate the presentation and as well as the Q&A forum. But of course, we don't have enough time again. And maybe Ken, if you have the time, maybe answer some of the questions in the Q&A box. But as we come to an end to this webinar, we would like to know your feedback and comments. So please fill up this evaluation poll and you may add comments on the speaker and the topic in the chat. So your feedback will be greatly appreciated. And we are now showing our evaluation poll. Please answer the following. The speaker demonstrated thorough knowledge of the topic. The speaker was well prepared and organized. The speaker spoke clearly and audibly. The speaker used appropriate language with technical medical jargons adequately explained. And finally, the speaker contributed to new perspectives and knowledge on managing various key health issues. So thank you very much. We will appreciate all your feedback. So again, thank you, Doc Ken, and to Dr. Stella. Before we move forward, we'd also like to greet everyone watching from all over the country and all over the world. No, we have attendees from Hale, Saudi Arabia, from the University of Rizal System Health Services, from the PGH Pharmacy Training and Research Team, from Guam, from Batangas, from the UP Philippine General Hospital, from Bataan, from Algeria, audience from Upmasa, from California, from Wisconsin. Thank you very much for ever being there during our Friday lunch date. So before we end, we'd also like to again take a quick moment to share with you an upcoming event. We're all excited. Do we have that video? TV.
Meron tayong webinar na advertisement, Dion. Can I say that first? can I just make the advertisement for next week, Dion?
Go ahead, ma'am. You can
Oh,
invite them po.
For next week, we have the topic is myasthenia gravis. Ano nga ba ang panghihinang ito? And our presenter is Dr. Carissa Joquino. Please watch us.
Okay, so for the meantime, for those who are very busy, wasn't able to finish this webinar, you can still watch us on the playback at the TVUP YouTube channel. And of course, we also have all these update webinars archived for viewing at the TVUP YouTube channel for your convenience. Also, we know that everyone's busy, so we have some selected presentations that will feature snippets of each of the webinars, and you can find them in the YouTube Shorts, so you can watch them at your convenience, still at the TVUP YouTube channel. There you go. Okay, so this formally closes our webinar for this week. We look forward to your company again next week on Friday, 12 to 1. It's a date.
Keep safe, keep healthy, and see you online.